Thank you, Madam Speaker. Madam Speaker, thank you for granting me this opportunity to update this August House and the nation at large on the COVID-19 situation in the country. Madam Speaker, Zambia recorded the first 2 cases of COVID-19 on the 18th of March 2020. Since then, the country has recorded 3 distinct waves of the pandemic, with a cumulative number of 208,267 confirmed cases, of which 3,636 deaths and 203,708 were recoveries as of 16 September 2021. The House may wish to note that all the 116 districts in the country have recorded cases. Madam Speaker, Zambia experienced the first distinct COVID-19 wave between July and August 2020, with a maximum weekly test positivity rate of 25.4%. The second wave was characterized by higher numbers of cases and deaths, with a wider geographic spread, and peaked in January 2021. The third wave started in the 4th week of May 2021 and has been the most aggressive, characterized by an exponential rise in positivity, unprecedented increase in the number of cases, hospitalization, and deaths reported on a daily basis. At the peak of the third wave, we were recording 200 daily admissions, with 75% of the hospitalized patients requiring oxygen for 2 consecutive weeks, while our intensive care units were always filled to capacity. Analysis of the COVID-19 trends shows that the country's third wave has been reducing, with positivity dropping from a peak of 26% in the week 20 to the 26th of June 20. Madam Speaker, our response. A multi-sectorial national response to COVID-19, enshrined in the COVID-19 National Multi-Sectorial Contingency Preparedness and Response Plan, was developed as soon as cases of COVID-19 were detected outside the People's Republic of China. The aim was to provide for a well-coordinated multi-sectorial preparedness and timely response mechanism to prevent and mitigate the effects of the COVID-19 pandemic. Government, through the Zambia National Public Health Institute, has been coordinating the technical response efforts to curb and avert continued transmission of COVID-19. Various public health interventions and restrictions were prescribed by government, informed by the epidemiological trends, laboratory data, and experiences within the country and globally. These measures are reviewed regularly to align to the COVID-19 evolution. Regarding coordination, Madam Speaker, various policy and technical committees were put in place to coordinate the response. These include 1, the Council of Ministers for Disaster Management, which is chaired by our Honor the Vice President, Madam Nalmango, which provides bridging policy direction. 2, it provides technical support to the Council of Ministers. 3, epidemic preparedness, prevention, control, and management committees chaired by the Minister of Health and co-chaired by ministers of local government at national level. This, the United Nations family, Africa Centers for Disease Control and Prevention, the World Bank, and the United States of America agencies, among other stakeholders. This coordination structure is replicated at provincial and district levels, with provincial ministers and district commissioners as chairpersons, respectively. 4. Incident management system. This, Madam Speaker, COVID-19 response stipulates actions and responsibilities for various stakeholders, including government and non-governmental institutions. Madam Speaker, various interventions based on the evolution of the pandemic experience include: 1. The application of the Public Health Act Cap 295 of the laws of Zambia and the statutory instruments number 21, 22, and 62, case detection and contact tracing, screening of international travelers and keeping track of alerts. Furthermore, school surveillance has been enhanced to ensure timely detection and management of cases identified in schools. A guidance document is available at all schools to support infection prevention and control, as realization of laboratory diagnostic capacity. The testing platforms are decentralized to support testing at provincial and selected establishment of a system to track variants of the SARS-CoV-2, the COVID-19 causing virus, to inform interventions referred to as genomic sequencing. 5. Restriction and temporary closures of social amenities such as bars, casinos, and nightclubs and schools. 6. Resource mobilization and engagement of various stakeholders to coordinate preparedness, surveillance, and response activities. 7. Strengthening of infection prevention and control measures. These include, but not limited to, safeguarding supplies, including personal protective equipment, gloves, masks, among others, and monitoring and enforcement of compliance to public health measures in public places and events. 8. COVID-19 treatment and isolation facilities were identified and customized to ensure safety and adequate patient management. However, these have not been adequate, and there's need to create more space countrywide for patient management. Madam Speaker, some health facilities still need renovations to meet minimum standards for infection prevention and control. Over 12,000 oxygen cylinders with accessories were procured to support the much-needed oxygen therapy. We are further mobilizing more oxygen cylinders with accessories, which are expected to be delivered before the end of the year. 9. Capacity building through training and orientation of rapid response teams across pillars is ongoing to ensure responders stay current with new developments and practices. 10. Risk communication and community engagement activities, which include engagements with community gatekeepers such as religious, traditional, political, and civic leaders. The media, including community radio stations, continue to be engaged. Further, production and publication of information, education, and communication materials in English and local languages has been a COVID-19 vaccine program, which is based on a basket of approved vaccines for Zambia. Vaccines are being acquired through the following pillars, Madam Speaker. 1, the COVID-19 Vaccines Global Access Facility, which is abbreviated as COVAX facility, which is a global initiative by the United Nations Family, Gavi, the Vaccine Alliance, and other partners. 2, donations of vaccine doses from bilateral and multilateral partners and through diplomatic channels. Thirdly, the private sector contribution to the acquisition of vaccines as guided by the Minister of Health to ensure that only vaccines that are safe, efficacious, and authorized are permitted on the Zambian market. 4th, government financing through domestic resource mobilization and partner support. Government has ordered 4.4 million doses of COVID-19 vaccines through the African Vaccine Acquisition Trust, known as AVAT, an initiative which is under the African Union and supported by the African Export and Import Bank. Government has already so far made a down payment of US dollars 6.6 million, and subsequent payments will be made as batches of vaccines are received. Through this facility, the country has already received the first batch of vaccines, consisting of 129,600 doses, which is the Johnson & Johnson. On the whole, as at the 15th of September 2021, the country had received 1,120,800 vaccine doses, out of which 680,110 have been used so far. Out of the targeted 8.4 million eligible Zambians above the age of 18 years, only 3.8% are currently fully vaccinated. Madam Speaker, we are concerned. The national COVID-19 response has been faced with a number of challenges, which include the following. One, there's a general anxiety among members of the public in complying with the prescribed COVID-19 prevention public health measures, including the 5 golden rules. Two, low uptake of COVID-19 vaccines, driven by myths and misconceptions which need to be addressed. Three, limited resources, including financial, human, material, both medicines and medical commodities, among of new SARS-CoV-2 variants. 5, imminent threat of a fourth COVID-19 wave. In view of the global trends, new variants, this August House, we are called to be ambassadors of change, starting with ourselves by adhering to COVID-19 prevention measures. As community leaders, we should use our cooperative advantage to promote comparative advantage to promote positive behavioral change in our constituencies and beyond, if we are going to prevent and control COVID-19 as a country. I wish to urge all of us to engage our communities and advocate for adherence to the stipulated public health measures, which include 1, wearing masks correctly and of not less than 1 meter. 4, avoiding crowded places like funerals, public meetings, and the like. 5, reporting to health authorities when displaying COVID-19 symptoms, including fever, cough, and difficult breathing. 6, encouraging members of the public to get vaccinated, as vaccination provides protection against severe disease and death. I further wish to urge those among us not yet vaccinated against COVID-19 to lead by example and get vaccinated. Madam Speaker, let me emphasize the need to mobilize adequate resources required to safeguard the health of our people. As we'll soon be debating the budget allocation, it is imperative that of our country, as this is what will enable us to attain socio-economic development of our country. In conclusion, Madam Speaker, allow me to thank His Excellency, Mr. Hakainde Hichilema, President of the Republic of Zambia, for prioritizing universal access to quality health care, as articulated in the UPND Manifesto. We are all aware that for a country to develop, we need a healthy and productive citizenry, and I urge members of this House to support this agenda. I further wish to thank the President for appointing the COVID-19 advisor to his office, as this will further strengthen our response to COVID-19. In addition, I'm pleased to note that His Excellency the President has led the way in championing vaccination against COVID-19 by graciously accepting to relaunch the vaccination campaign tomorrow, Thursday, the 7th of October 2021, at the Olympic Youth Development Center, OYDC, which is situated here in Lusaka. The relaunch is intended to rejuvenate the COVID-19 vaccination campaign in order to raise awareness and to create unprecedented demand so as to save lives, livelihoods, and the economy of our country. Madam Speaker, may I use this opportunity to seek the support of all the members of parliament who have so far been invited to this launch, and hope that they will be, even whether they are vaccinated or not, it will just be good that they show the communities in their constituencies that they support vaccination of COVID-19. Madam Speaker, following the national relaunch, the provinces, the districts, the constituencies, the wards, and chiefdoms will be expected to launch their vaccination program in order to ensure quasi-government institutions, cooperating partners, learning institutions, private sector, civil society organizations, traditional leaders, political and religious leaders at various levels, the media and members of the public are all expected to fully participate in this vaccination drive. Our healthcare workers are also urged to arrange to take vaccines closer to where our people are, such as markets, bus stations, learning institutions, and places of worship through outreach services. Madam Speaker, I wish to reiterate that while COVID-19 restrictions have been eased, this is not the time to drop the guard. We must continue to observe the 5 golden rules and encourage everyone to get vaccinated. I will be failing in my duties if I did not appreciate and commend our healthcare workers and other frontline personnel who have been working tirelessly to fight COVID-19 while providing other routine essential health services, which we shouldn't neglect as a country. Finally, I wish to take this opportunity to thank the COVID-19 multi-sectorial stakeholders who continue to put in a lot of effort in the fight against COVID-19 while supporting overall health system strengthening. Together, we can defeat COVID-19 while protecting the gains we have made in other public health priorities. Madam Speaker, I thank you.
Thank you. Honorable members are now free to ask questions on points of clarification on the ministerial statement given by the Honorable Minister of Health. Honorable Member for Mufurira.
Thank you, Madam Speaker. I've been informed that where I'm sitting, there is a technical problem with the cameras. So, Madam Speaker, you're not able to see me in the diaspora. Minister of Health, thank you for that statement. It's very clear so far in this experience with COVID that there are benefits getting the vaccine, both at an individual level and also at a country level. So now, Minister of Health, is the government considering compelling or making it mandatory for public workers to take the vaccine in order to up the numbers of the vaccines and also to prevent severe infections in the country? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Health.
Thank you, Madam Speaker. Thank you, Honorable, for that important question. Madam Speaker, we will see, we'll cross the actions of the public as it relates to following the 5 golden rules. Thank you.
The Honorable Minister for Fair, the Honorable Member for Fair.
Thank you, Madam Speaker, for elevating